Welcome to the Heart Health Summit. I'm your host, Dr. Mark Menelcino, certified functional medicine practitioner and director of the Mental Clinic Center for Functional Medicine in beautiful Jackson Hole. Thank you for joining us, and this is your opportunity to hear from international experts to provide optimal heart health for yourself, but also to help you achieve optimal vitality. Today we have Dr. Kat Toups joining us. Thank you so much for joining us, Kat.
Oh, I'm so happy to be here. Thanks, Mark.
Well, let me brag a little bit about you to our viewers today. And Kat's someone I've known for many years. She's one of the leaders in integrative functional medicine. She's got a burgeoning practice, and she's really someone that I think you'll enjoy listening to today. Dr. Kat Toups is the functional medicine psychiatrist at the Bay Area Wellness in Walnut Creek, California, and the organizer administrator for the Bay Area Functional Medicine Group since 2012. She's a distinguished fellow of the American Psychiatric Association, board certified by the American Board of Psychiatry and Neurology, and previously boarded in geriatric psychiatry. She's active in local psychiatric associations. She was on the board of trustees for the California Psychiatric Society, served as a counselor at large, and co-founder member of the NCPS Integrative Psychiatry Steering Committee. She's very active in the East Bay Psychiatric Association, serving on the board of trustees from 2006 to 2012, and as president from 2009 to 2012. Dr. Toups is a former assistant professor of psychiatry at UC Davis. She was inpatient residency training director, and later the owner and medical director of the Bay Area Research Institute, which was a clinical trial center in Lafayette, California. She served as principal investigator for over 100 clinical trials over 12 years, including 12 in Alzheimer's medications. She's found that the elusive cure for brain psychiatric illness may not be found in a pill, and I'm excited to hear more of her thoughts on that. She personally embarked on an intensive course of study to learn functional nutritional medicine and was one of the early completers of the Institute for Functional Medicine certification in 2013. She's a certified practitioner by the Institute for Functional Medicine. Dr. Toups practices functional medicine psychiatry, which seeks to discover the underlying causes of inflammation, which may be diet, nutrition, lifestyle, genetics, including MTHFR, which she'll talk about, food allergies, dysbiosis, gut health, toxin exposure, and chronic infections, including biochemical abnormalities. These can all be contributors to psychiatric symptoms and cognitive difficulties. Detection and correction of these problems can result in the resolution of psychiatric symptoms rather than just proving a Band-Aid by prescribing psychiatric medicines. She really searches for the underlying cause, and she works with people from all aspects of health challenges, and her niche of the psychiatric and medication understanding allows her to provide a more functional nutrition base. Again, thank you so much, Dr. Kat Toups, for joining us today.
Thanks. That was quite a long intro, a romp through the past.
Well, you deserve it because you've worked hard to get to where you've at, and this isn't something you learned in medical school. I know you've shared with me that you've had a personal journey, and a lot of people in nutritional, functional, integrated medicine have kind of a personal story. Could I ask you if you'd share that with us?
Of course. Well, lately I've been focusing my practice on working with dementia and reversing cognitive decline. And I came to functional medicine because of my own brush or bout with dementia. Probably when I was about 50 years old, I was doing clinical trials. I actually have done 20 clinical trials with Alzheimer's and mild cognitive impairment. And I was testing my patients, and I came to realize that I was as cognitively impaired as some of my patients. And I would do a mini mental status exam where I had to give them 3 words to remember, and I couldn't remember the words myself. And I had used that test for more than 20 years. So I had 2 sets of words I alternated with, and I would have to write them down to ask my patient. But what had happened was I had developed multiple chemical sensitivity. I got allergic to absolutely everything. I was covered with rashes, covered with hives, had severe chronic fatigue, couldn't get out of a chair for a year. And all of that inflammation in my body was ravaging my body, but it was eating out my brain. And the brain function just got worse and worse. I mean, it's nobody thinks of dementia in somebody that's 50 years old. But I knew enough to know that I actually have treated patients with dementia in their 50s, and it goes very rapidly. So it's quite a different critter than late onset dementia that occurs after 65. I got to where I couldn't drive a car safely. I could no longer back up or parallel park the car. My brain couldn't sequence those things. I couldn't use a computer very well. I couldn't remember how to do things that I used to know how to do. And I would ask my husband how to do something, and he would get mad at me because he said, I just showed you that. And I couldn't remember that he had showed me that. Wow. I developed trouble hearing, and I couldn't understand what was being said. I kept going to the ENT and saying, I need hearing aids. And they would test me and say, well, you just have a mild hearing loss. You don't need hearing aids. And one day the doctor looked at me funny and he said, it's not in your ear, it's in your brain. And I had developed an auditory processing problem, and so I couldn't decode what was being said when there was muffled or background noise. So it all kinds of things were happening.
What a scary time, Kat.
And it's at the time I wasn't thinking in terms of dementia. I wasn't thinking that my processing was impaired and that my visual spatial sequencing was impaired. I was just trying to survive every day. So that is actually how I came to learn functional medicine. I went to a conference called Food is Medicine, and it just totally blew my mind and opened, this whole new type of possibilities of actually helping people get really well instead of just managing an illness. Because the type of illness I had, I would be drooling in a nursing home by now, if I hadn't have learned functional medicine and got my brain back online.
Well, I'm sure in your psychiatry residency, they taught you quite a bit about nutrition.
Yeah, like zero, right.
Joel Kahn told us that in the cardiology boards, there's no questions on nutrition and there's no training in nutrition because there's no questions on the board exam. So we really had to learn this on your own, didn't you?
Well, and it's the same thing with the GI doctors. And, in the course of learning things and developing several autoimmune illnesses before I got well, I went to the GI doctor and, was having an acute problem from taking some metal out of my mouth. And I said, well, do you think this could be related to my gluten allergies? And the GI doctor said, I don't know anything about food allergies. I don't deal with that. So yeah, it's changing, thankfully, right? Lots and lots of people are coming to the table and understanding the importance of functional and nutritional medicine and how we really can, halt disease and even reverse disease.
I had an interesting conversation with Dr. Rupi of the Doctor's Kitchen, who practices in London, and he was asked to speak to the medical students at Bristol and do a cooking class, which is exciting. And I think more students are wanting nutrition, and they're pushing the universities, the medical schools, to add more nutrition classes. So I think that the new generation of doctors realize that nutrition is important. How are you able to implement this? Are you using health coaches? Are you doing one-to-one? Are there longer visits? How do you really break that barrier to let food be medicine?
Yeah, I have a nutrition health coach that when my patients come to see me, they see me and then they also see the health coach to get started on the diet. I'm pretty fortunate here in the San Francisco Bay Area. There's a lot of awareness of nutrition and many people actually come in on very good diets. So it's quite different in other parts of the country where people aren't so aware of nutrition. And so for many people, they're already eating a clean diet, but then sometimes it's fine tuning it to their metabolic needs, right? Do they have heart disease? Do they have lipid problems? Do they have hypertension? Do they have obesity? What's their blood sugar control? And then, and working with the dementia and cognitive patients, there's so much benefit of the diet for cognition.
And I'm sure you have a lot of people that come to you on different diets or they've tried different things. How do you try to kind of clear the slate for them and get to a starting point that allows them to start actually building? Is there a core plan that you start people on, or is everyone start at a different point? How do you assess where to start?
Yeah, I mean, in order to get an appointment to see me, people complete a questionnaire because I always have a long wait list. And one of the questions is, are you willing to undertake radical dietary and lifestyle changes? Because if you're not, forget it. if you want to get well, you have to start with the diet. That's the foundation of everything. And, the purpose of your summit here is to deal with, heart and cardiovascular issues. And of course, the root of that is inflammation. And inflammation is the root of all chronic illness, right? And so how do we begin to control inflammation? The very first part that we all have control of is what we put in our mouth. So the food can be inflammatory or can be anti-inflammatory. So for my purposes, I ask all my patients to stop gluten. I know you're aware of this, but gluten is the most inflammatory thing we eat, and it's been hybridized to have higher and higher gluten content that destroys the lining of our gut and promotes leaky gut. And the gluten, of course, is the first thing, because it's causing the leaky gut. It gets through, into the bloodstream and calls out the troops to kill that invader. So it's a very inflammatory food. It also has got a super high glycemic index. So the gluten is 20% higher sugar than table sugar. And people say, well, I don't eat white bread. I eat wheat bread. Well, the wheat bread is a higher glycemic index than the white bread. So, excuse me. The first place to start with is, even before the gluten issue is, of course, are you eating processed food? We need people to eat real food. We need to eat whole food in its natural form. We don't want all the additives and preservatives and the nutrients killed in our food. We need to avoid the toxins in the food. And, that's a whole nother can of worms. But all of the genetically modified food and the pesticides and the toxins, as I test people for toxins, it's just ubiquitous.
Yes.
I test all of my patients with that come in with cognitive decline and dementia for many, many things. But when I test the toxins, every single person is high in Roundup or glyphosate, even kids, even young people. I've eaten organic food for almost 20 years, and I have eaten religiously organic since 2009 when I got very sick, and I was in the yellow zone.
Yes.
And, it's still there.
Yeah. We were talking to Joe Pizzorno the other day about this, and the half-life of some of these chemicals is decades. So as yourself mentioned, you go completely organic. It just takes a long time for these toxins to leave the body. Yeah. And you're right. The kids are really our front line of concern because they're getting exposed to these all the time. How do you help women understand about this concept of what's in their food and how to make good choices? Are there some simple rules or some simple places where they can start?
I think the easiest place is to start to, the typical teaching of shop around the outside of the grocery store, the vegetables and the fruits and the meat and the chicken and the fish, and avoid all the processed stuff. I think so much of our decline came with the health of certainly our nation here in the 1960s, when we got Hamburger Helper and processed foods in a box, and it seemed like it was a useful thing. When I was pregnant, I thought eating lean cuisine frozen food was healthy, we've been sold all of this incorrect advice. So some of it is just trying to help people understand that, first off, just start with simple, real food. And when you stop eating stuff with so much sugar, the sugar, of course, is a huge drug for people. And it's so hard for many people to stop the sugar. But once you get past the hump, and your microbiome changes very rapidly when you eliminate gluten, you eliminate sugar, and then people hit a point where it's gone. They don't crave it. And I know for me, if I eat out at a restaurant, I'm very sensitive to when they put sugar in food because my taste buds don't want it anymore.
I'm sure probably every person listening right now say, Kat, how do I stop my sugar cravings?
Yes.
How do I do it? Do you have any simple solutions or ways they can start?
Yeah. I was the biggest carb junkie imaginable. And my doctor in college, I was a sugar junkie before that. And I was having problems with getting headaches, and it was from low blood sugar. I would eat a candy bar, and then my blood sugar would crash and I get a headache. So the doctor said, quit eating candy, sugar, Cokes, whatever. Okay, so I'm a good patient. I quit all of that and I started eating bread. I'd go to the cafeteria in college and I'd get a salad and 6 dinner rolls. So I was a huge carb junkie. And what really helped me to get off of my carbs was glutamine. So glutamine is a simple amino acid. It's in all of our food. We often use it in functional medicine for gut healing.